Well, good afternoon, everyone. We'll go ahead and get started this afternoon. We'll call the meeting to order, and all trustees present except for Jim. So to address the quorum, we are here. Consent agenda, we had A through D. No approval of September agenda, approval of August meeting minutes, approval of credentialing of applications, and approval of monthly payroll and claims for August. Was there any discussion needed on any of those four bullets before I ask for a motion? All right, if no further discussion, can I get a motion to approve?
I'll make a motion to approve those 4 items.
Second.
Got a first and a second, all in favor?
Aye.
Opposed, same sign. Motion carries. All right, we'll go to bullet number 4, Med Staff meeting, and it's by Chief of Staff, Dr. Devine.
We'll sum up the September 9th, 2025 meeting. First was the quality improvement reports and policy and procedure manuals for each department, and those were gone through in detail. We didn't have any concerns. Then we had a presentation by Adam Porter, who is one of our PharmDs, regarding urinary tract infections. There's new classifications of them. They're still urinary tract infections, so it's just they reclassified things. And we discussed cannabis hyperemesis syndrome, which is becoming more common in our community, and how to treat it in ER because it's a little different than our other emesis problems. Nicole reported that we'd received a 4-star rating from the HCAHPS, which is wonderful. That comes directly from patient experience. Also, the Society for Maternal Fetal Medicine recommends, and we will be doing cervical length assessments at 20 weeks with vaginal ultrasound. That just, instead of doing just the outer ultrasound, you also do the vaginal, measure the cervix length. If it's too thin, then we know that there's an increased risk for premature birth. And so that helps risk stratify parents. There was a cluster of individuals in Marshall County diagnosed with Legionnaires, so we reviewed that and care of Legionnaires. The recruiter for OB-GYN noted that most residents want to utilize robot-assisted surgery, so we have that. And they don't want to be all alone, and we have that. So we've got some positive things going for this facility on that. Dr. Francis had her baby on September 5th, and she will continue with her OB fellowship following her maternity leave. Adult and pediatric urology has merged and will now be known as UroHealth Partners. We had the appointments and reappointments approved, and that is pretty much our entire meeting. Any questions?
All right, thank you, Dr. Devine. Next, we'll go to the quality improvement report. The Director of Quality and Risk Management, Laura.
Okay, on September 17th was our last system-wide QI meeting, and we had 17 departments report. Behavioral health is monitoring their no-show rate. They really want to decrease that overall no-show rate, and then also assure that documentation that we're communicating back with those patients that did not show up, and that we're kind of bridging that a little bit, as well as substance abuse evaluations, which was at 100%. Cardiac rehab assessed improvement following cardiac rehab services. Diagnostic imaging monitored the rescan rates, which was 3.7%, where the national average is 6%, so that's really good. We want to be lower on that, as well as breast cancer screening recall, and then the dual CAT scan rates, which we were below the national average on that too, which is where we want to be on that. The emergency department really is focusing on stroke evaluation. We had 7 patients, all 100% of them had a CT scan appropriately. Environmental Services has a new monitor for monitoring high-touch services. They're cleaning and then testing and then kind of seeing what bacteria remains after that. So that's a new monitor that they are doing. Facilities reported their compliance with fire drills and inspections. They are doing fire alarm testing on every shift throughout the day on a quarterly basis. Medical records monitored completeness of documentation, which was really good. Lab reported 100% on newborn profile screenings getting to the state hygienic lab. So anytime we have a newborn, they test for certain things on this newborn screening profile and it gets sent to the state hygienic lab. It's kind of difficult because sometimes they have to send them back if it clotted or something like that, or is layered. And so that was at 100%, which was excellent, and they have to be at the state hygienic lab within 65 hours, which we met that fully as well. MedSurg reported no falls, and that's kind of highlights from that. And then on page 17, 18 and 19 in the packet is the compliance, our annual summary for the compliance report. I guess, Mike, should I just go right into that as that's the next?
Yeah, that'd be great, thanks.
So the compliance committee meets 6 times a year, and it's a robust committee. It includes a provider, senior admin, and then some key factors or key players in the revenue cycle department. So the annual summary is on those pages. We did see of note, there was a 1% decrease in denials from last year, so that was a good overall in the hospital billing and professional billing. 100% of current employees completed all annual training. So there's a really robust annual training system. We did get a new learning management system for employees where they can do it electronically. It's tracked really well, and that was really well received by staff as well. So that was really good. Clinical departments review all of their charge routers, and the RHC is reviewing billing with transitional care management. Utilization reviews appropriate level of care for patients and that they meet the continued level of stay throughout their stay. And then 340B program, we do meet quarterly for that 340B program and have a robust compliance program there, and they do a great job. But I do believe that I think that needs approval, that annual summary. But that is, if there's any questions at all.
I'll move the approval of the annual compliance summary.
Okay, got a first and a second, all in favor? Opposed, same sign. Motion carries. Administrative reports, Chief Nursing Officer Nicole.
All right, so we held our quarterly joint conference meeting on August 6th. So emergency services and disaster planning, Jenny did report that we had a trauma case study held here on July 22nd and had about 30 people in attendance for that. We will recertify our level 4 trauma certification in the 26-27 year. Jenny also reported that we received a number of AHA awards, so I'll go through those. As Laura mentioned, we are definitely focusing on stroke in the ER, so we did receive Rural Stroke Gold and Post-Acute Stroke Gold awards. And then from a cardiac standpoint, we received the Rural CAD STEMI Gold, the Rural CAD Non-STEMI Gold, and Get With The Guidelines STEMI Gold Plus for that. And then for CHF, we received a silver this year, so that would be congestive heart failure. Bailey Ertz will be taking over as our pediatric coordinator in the ED. She was one of the nurses that passed her certified pediatric emergency nurse exam, and she's doing this as part of her clinical nursing ladder. For lab, Jason reported there were no proficiency failures. 3 events occurred, but none of them reached the patient. Nancy reported we had 4 recall notices from a pharmacy standpoint, none of which affected us at Myrtue. As far as critical access hospital inspections and appeals, pharmacy had their annual audit and passed they were in compliance with no deficiencies. In June, we had a dial investigation related to an EMTALA complaint, and so we had dial here for a number of days. They reviewed 24 charts and interviewed some team members and found no deficiencies, and the complaint was unfounded. So that's pretty substantial and great work for all of our staff here. We also reviewed annual and quarterly policy and procedure manuals, which starts on page 20 in your packet there, if you want to review those. And then with joint conference, we have EPIC order sets in our electronic health record. So we have added those as an annual review as well, so that if we have order sets in there that we aren't using, we can get rid of those, and then we just continue to evaluate the ones that we are currently using. Laura reported on core measures, and that's all I have for joint conference, so I do need approval for those minutes.
Okay, we had these sent out to us early in our packets, so anybody have any questions or comments on the policy and procedure revisions? If not, can I get a motion?
I move approval. I'll second it.
I have a first and a second, all in favor?
Aye.
Opposed, same sign. Motion carries. I didn't see.
Kim is going.
Okay, so we'll pass over that. Next we'll go to the Human Resources Officer, Jill.
Sure. So I'll start with recruitment and some of our higher level positions that we have recruited for that we're in the process of. So we have hired a psychiatric mental health nurse practitioner. She's going to start with us in mid-December. We are familiar with her. She did her PMHNP preceptorship with us in 2024, so we're excited for her to join us. And OBGYN recruitment, so Dr. Kelly Anderson, our OBGYN, Dr. Ryan Anderson, Barry, and myself are having an initial call with a fourth-year OBGYN resident this afternoon. She's currently in the New York Health and Hospitals Residency Program in South Brooklyn, so she's getting some good exposure to a diverse population of patients there. She's very much interested in rural family practice and obstetrics, and so she is going to be visiting with us here this afternoon. She would like to make a decision by or in November, so her time frame is pretty short, so we'll get to meet her today. And then we have a couple of items, couple of community events going on that Myrtue is marketing internally and with the community. September being Ovarian Cancer Awareness Month, and our own Jill Ferry, physician assistant, she spearheads that effort in memory of Nadine Kinkle. And so we have a silent auction going on right now through tomorrow at noon. And then October 1st is the Healthiest State of Iowa Walk, and Myrtue participates in that walk every year. And so we welcome our own staff to join us over at Pioneer Park at 12 o'clock on Wednesday, October 1st, and anybody in the community who would want to join us for that walk as well. And then as we get close to October here, we also recognize Breast Cancer Awareness Month, so we have a lot of marketing that takes place around that, and we will be asking the community to all wear pink on Wednesday, October 22nd.
All right. If no questions for Jill, we'll move on to the Chief Information Officer, Jeff.
All right. This week, we're installing a radio system to improve public safety communications on the statewide interrupt network. The tower stands out at Westphalia, just right on the corner of 59 and Westphalia there. But because of the structure of the building, we don't have much signal inside. So we are adding antennas into the ED space, one up in here to improve. So during disasters and war room type events, we've got the good radio communication. So that should be done tomorrow or Thursday. Might hear some noise on the roof. That's actually for behavioral health. The behavioral health building down here, community health down Block South. This building, the hail damage from last year, we're just getting it scheduled now to get fixed. So you might smell some adhesive, you might hear some drilling and pounding, so that's what that is. Last week was EVS week, recognition of our housekeeping staff and EVS staff there. A lot of kind of small daily activities to celebrate the work efforts. We've always gotten great reviews on how clean the hospital is. Wednesday, they had a luncheon and Barry and I attended. And so, I mean, a good week to recognize those staff. This week, we do have one retirement off of the staff. So we have one opening, and then that person is already backfilled. We're lucky enough to be allowed to hire their backfill. So good move there. So we really only have one opening in EVS. The construction is getting real exciting. You saw the concrete was poured on for the parking. I believe today they were pouring sidewalks and a couple other areas. So outside's really coming to shape. I believe next week or the following you'll see a lot of landscaping being done. So that's good. Next week the elevator goes in. Up on behavioral health, the second floor, carpet's already in, so when I send my update, I'll have a picture of that. So things are really starting to come together. Thursday of tomorrow, or Thursday this week, the above ceiling inspection is going to be completed on the first floor. So things are really starting to get close there to put the ceiling in and start buttoning that up. We will start moving into the existing clinic to remodel a little bit there. We have the rest of the reception that we'll have to take out. We'll get the new reception up and running. We have just that really patient-affecting spaces yet need to be done. So that'll be coming up over the next couple months. All indications are we're on track. Once we get significant completion request, we estimate 2 weeks worth of work internally ourselves to get the space prepared by moving in all the exam tables, getting all the computers and the printers mounted. I think we have to put 70 new computers in. So a lot of work on our side that we have to do to get it all ready. We'll have an open house. We've had one very brief meeting to discuss an open house, so that will be coming. We'll definitely, you guys will be front and center on that. So, have a ribbon cutting and everything, hopefully moving forward with that to celebrate the new space. Med-surg, we're working on the punch list on the rooms there, so hopefully we're within a couple weeks of 2-3 weeks of that and ready to open. So we've got a few other concerns that 2 of the rooms we have had to remodify a little bit, so they're going to be a few more weeks after that before we get going. But the main push is that west hallway. There'd be 9, right? I think nine rooms that are been remodeled there.
Great. Thanks, Jeff. CEO Barry with some organizational goals.
Can you bring the org goals up, Jeff? So we have our org goals, the results of our organizational goals for the 24-25 fiscal year. So I wanted to go over that with you today. This is very similar to what we've had in the past with our pillars under community, finance, growth, people, quality, and service. And then we have seven goals under those 6 pillars. We score ourselves on a scale of 1 to 5, with 5 being the best. So you can see what our score is for 2025, 4.25. A little bit fairly consistent over the last 5 years between that 4 and 4.5. So I'll go through each of these goals, just a little bit spend a short amount of time on each one. We look at volunteer community hours each year, and this year we're up around 8,300 volunteer hours. So that was an increase from what we've seen in the past. So we're up to a score of 5 on that, and we have a weighting for each goal. This one's weighted a little bit lower at 5%. And then finance, obviously an important goal. It affects all the other goals that we're trying to achieve. This year we had a very good year with, we look at basically our increase in net position, but then we remove the impact that the IPERS adjustment has. We don't have really any control over that one. But our goal is to be over 3 million. I think there's a few changes that will have to happen yet with the audit, but we think we're going to be around 5 million for that increase in net position, not including the IPERS adjustment, that put us at a score of 5 on that particular goal. Growth, this is really about just finding ways to improve the organization. The way we measure it is the new services that we've had in the past year, and these don't have to be new patient care services. They could be something maybe new that a service that HR is providing to the rest of the hospital. So it doesn't have to be all patient care. We had 21 this year, which puts us at a score of 3. Kind of did list those out for you. There's several items related to the emergency room, new services that we can provide now that we have the new space. Quite a few new services in the surgery area, kind of highlighted by the robotic assisted surgery. And I'm not going to read through each of those, but had some good new services this past year. And then we look at our people, of course. We use our employee satisfaction survey to measure ourselves on this. We also look at retention, which is the next organizational goal. But this last year we had, we basically look at all the responses that we get. I think there's about 20 questions that are asked, and we look at all of those responses, and our goal is to be above 90% positive on those responses, and this year we're at 93%, which is a score of 4 for that particular goal. And then the other goal, like I mentioned, under people is retention. So we're trying to obviously keep all of our good employees, and we were at about 88.6% this year, which is just a little bit down from last year, but quite a bit better than what we did in 2023. So that was a score of 4 also. And then under quality, we look at, we've got about 125 core measures that we look at on a quarterly basis, and our goal is to have, we have a benchmark for each one of those measures, and our goal is to be above the benchmark on at least 75% of those measures. And we were at 81% this year, which was a score of 4. This is the goal that we weight the highest, is the quality of care that we're providing. And I put this up here. I can't even really read it, but this is kind of a list of all the goals. There's like 4 pages of this, and we measure it each quarter, and then for the full year as well. And if it's green, that means we're above the goal, and red means we're below the goal. And you can just kind of see mostly green. We got a few more reds here near the end, but a lot of really good work done in that area this past year. And let's see, we got one more here. So patient satisfaction, we have several patient satisfaction surveys that we do, and on each one of those surveys is a question about overall satisfaction for the visit or the stay or the procedure. And what we want is a score of 9 or 10 on that particular question. Or that's what we're measuring. We want more than 85% of those to be a 9 or a 10. And this last year we were at 94% for that score, which is a 5. And you can see we weight that at 20%. So overall, very good report to be able to provide to you. There's been a lot of great work that's been going on here in the hospital by a lot of people, and all while we're changing the facilities pretty significantly, and so a lot of disruptions, a lot of extra work related to that. So pretty proud of the work that our staff has done this past year. For next year, we're looking at keeping the goals really the same. We're not looking at changing anything for next year. And I would, if you have any questions, but I will want to get approval for the goals for next year. So that's kind of concludes that part of my report. Any questions on the goals?
Very good.
Yeah, nice work by everybody. Yeah, very good. Can I get a motion?
I would move the approval of proposed goals for 2026.
Second.
First and a second, all in favor?
Aye.
Opposed, same sign. Motion carries.
Okay, then I wanted to go over the economic impact report. This is a report that the Iowa Hospital Association does every year. You've seen it. I show it to you every year. I think it's important to put it out in front of the board, just kind of remind us how important we are to the community beyond the healthcare services that we provide. Obviously, we're economic engine for the community. The way they do this is basically they're showing what the impact would be if the hospital did not exist. 887 jobs would go away. We have about 425 employees, but you apply the multiplier when you consider all the money that's spent by our staff, so it obviously affects other jobs as well if our hospital wasn't here. Do the same thing with wages. I think our wages this year were around 20 to 21 million. So you double that when you look at the impact that it would have overall in the community. Do the same thing with overall expenses, and the overall impact there is about 94 million in total expenses that would pretty much go away without the hospital. And they also look at the community benefits that were delivered, and they look at it from the standpoint of dollars and number of people that are affected. So this is really related to bad debt, uninsured discount, prompt pay discount, charity care. It has a little bit to do with some of the things that we subsidize, like our self-administered drug discount that we provide to inpatients here in the hospital. And then also, I think we include the wellness center subsidy that we provide each year in that dollar amount. But, yeah, so just kind of a reminder, the IHA uses this for advocacy. I'm sure they used it quite a bit this last year with all the changes with Medicaid, just to show how important each hospital is to their community. So I think that's all I have on that. I did just want to bring up the wellness center is closed, or the wellness center pool is closed right now. We're having to replace all of the cables that hold up the ductwork in that area. So we do have a contractor that's working on that. I don't have a timeline yet, but we are moving forward with the repairs on that ductwork. So I think that's all I have, Mike.
Perfect. Next, we have a capital purchase request for some operating room integration system. This is going to be by Nicole, Chief Nursing Officer, and Shay, the Director of Surgery.
So first, I will introduce Shay. So Shay Pogansey joined us in March of this year. She actually worked here within our surgery department in 2020, and then went back to school to get her master's, so went PRN at that time, and then rejoined us here in March. So Shay's gonna go ahead and take it away with the proposal here.
So we're proposing a new integration system. The integration system is basically just the control center of the OR. It connects all of the technology, cameras, monitors, lights, the documentation. That makes them all work together smoothly. When it's done well, everything can be controlled from one place. Makes things, surgery safer, faster, and easier for the team. That's just a standard picture, kind of an OR. Some of the stuff that we're talking about be the lights, the booms, the monitors that display things when we're working on them. The goals of the integration system, the purpose is to improve patient safety, streamlining workflow so the team can focus on the patient and not the equipment, supporting modern surgical technologies, increasing interoperability and ensuring that all devices work together seamlessly, enhancing communication between team members, and meeting compliance requirements and industry standards. Some of the driving forces behind this upgrade: the equipment is outdated, new surgeon kind of going in a new direction with robotic-assisted surgery. We've got some surgeon preferences, expanding services with the robotic-assisted surgery, data-driven care, and then some cybersecurity stuff there. Our current system was purchased in 2012, so it's 13 years old. It's reached end of life. They have noticed some issues with some of the stuff running up inside of it. Our current system is actually made up of two different systems. Currently, we have Stryker for the lights, booms, and the screens, and we have Arthrex for the cameras. They don't fully talk together, therefore there really is no integration. It creates extra work and makes things a little bit harder to figure out when problems arise, where they're coming from. So what we're looking at, there's two different options. Stryker has a one-company model. This is the surgeon's preference. It's what they're more familiar with. It is one single, fully integrated system. They have been incredibly supportive and helpful in our working relationship with them, and their customer service is wonderful. With this option, each OR would be down 1 week for a total of 2 weeks, and then we have kind of the cost breakdown of that one. The other option is Arthrex and Skytron. They're two different companies. Skytron does the booms, the lights, and the monitors, and Arthrex does the camera side of it. So they combine to make an integration system. The surgeons are less familiar with this setup. Each OR would need to be down for 4 weeks for a total of 8. So a little bit longer of a disruption to our schedule.
And to elaborate a little bit, when we put this together, we didn't put in there the construction costs, but what that equates to is if we go with the Arthrex and Skytron system, we will have to go in and do some work on the ceiling grid so that it can hold their booms and lights and that sort of thing, whereas if we go with Stryker, it's basically just kind of a switching them in and out and less extensive from a construction standpoint. With both systems though, we are going to, in our OR Suite 2, the way that our door swings right now to go into sterile supply, we would like to flip that. And so with either system, we are going to internally have our crew go in there and flip the hinges on that door so it opens the opposite direction. So that's just a little elaboration on the construction costs.
So our proposal is to purchase the Stryker operating room integration system because of the need for upgrade, surgeon preference, the quality, and their quality of service. Do you guys have any questions?
Is there any difference between the two as far as warranties or ongoing maintenance or support costs?
So Stryker, we have an agreement with them. It's called a ProCare plan. And so what that is, we pay a amount, and that covers a lot of different things that they already provide with us. And I did ask them, and some of this stuff that they will be giving us will go towards the ProCare. Their reps have been really phenomenal about, even if it's not something that's necessarily theirs, if I'm having an issue, they'll send something out to help me, even if it's not something that they're really in charge of.
Did that answer your question, James?
Yeah, I think I just didn't know if, there was associated maintenance costs with either one that were going to be significant, and we look at a system like this of having yet another 10-year life or span or better.
That's the hope, yes. Most for an integration system like this, we would hope for 10 years in the OR. And it's hard because I don't think we're comparing apples to apples with the two companies to determine, like, are we getting the same from both from a service agreement standpoint. With Stryker, we currently have their power system for our orthopedics. We're using their insufflators. And as Shay mentioned, it's just, they're always fantastic. We reach out to them and usually have an answer in 24 hours and like a piece of equipment to help us to continue to provide services to patients versus being down and not being able to continue to operate. So.
And obviously, a lot more downtime than the on the other system.
Right, and that was due to the construction and having to change kind of the ceiling grid and make adjustments there to implement Arthrex Skytron versus Stryker. And so Christy helped us put those numbers together with what the cost of being down is during the time frame and what the difference is there.
Yeah, the support structure that you mount the boom to is incompatible between the two, so it's a rip and replace. So that's why the increase in cost.
All of the Stryker maintenance contracts that we have been very reasonably managed. I mean, they don't come in at a low ball price and then turn around a year later and really jack them up. They're really reasonably increased a small amount each year. So, I mean, they've been very fair on that side of things too, so.
I will say when we were looking at both of these and trying to compare the two, Stryker had given us a quote and Arthrex Skytron had given us a quote. And so then each company came out, looked at our OR suites, determined like exactly what we need to do. And Stryker did realize that we were gonna have to have an adapter plate to change out the lights and booms. And so they did provide that to us, basically free of charge. So we paid for it, but they took that amount off of the initial quote. So, like I said, they've always been fantastic to work with. And we would think that they're going to continue that moving forward.
The rep that provided us with this quote is actually the rep that put this in 13 years ago, which I think speaks a lot for their company.
Yes.
Yeah, and longevity of their employees.
And do you feel that most of the staff that's worked with this particular manufacturer, they're fairly comfortable and happy with their performance? Or you say there wouldn't be a huge learning curve?
No, so from a nursing standpoint, that this is what everybody that's worked here has worked with is Stryker, because that's what we've had aside from the cameras, which are Arthrex. And then Dr. Garten, coming from Fremont, Dr. Kelly Anderson has been here since 2020, but that's what she was familiar with working on outside of here, like when she was in Michigan and things like that. So it very much is surgeon preference as well. They really like working with Stryker and they're used to it and comfortable.
So Mike, I'll move to go ahead and approve the purchase of the Stryker system for the $724,000 or whatever the amount was up there, $723,245.
Second.
Perfect. We got a first and a second. All in favor?
Aye.
Opposed? Same sign. Motion carries.
Thank you all very much.
Thank you.
Oh, wow.
Next, we'll have Christy, the CFO, talk about our financials.
Okay, first of all, as Barry mentioned, the audit, we did have the auditors out for 3 days last week. We had a whole new auditing team except for Jeremy, and he was here one day, but it went very well. Ashley's new and payroll clerk Kim's new, so kind of had a few more questions, but it went very well. Have had very little follow-up questions since they left, which is very nice. So Jeremy will be out for the next board meeting to present it to the board, and then we'll have a finance committee before then to go over maybe in a little more detail. So just keep you up to date on that. So the July financial reports are up there. As you can see from our visit perspective, we were down a little bit in outpatient visits, about 173 in our outpatient clinic. July is not an extremely busy month, so it can fluctuate based on weather, We are seeing a little bit of an increase in our ER visits, so we were up 2.3%. Surgical procedures are up 8.8%, so continue to grow that with Dr. Garten on staff. The physician clinic visits were down a little bit, summer vacation time, those type of things. Behavioral health visits were up 6.8%, busy month there. Average daily census for July was 4.39 compared to 6.13 last year, so we were down 28.4% in the number of patients that we had on the floor in the month. Births, we had 11 compared to 10 last year. Our revenues were up about 7.5% to 5.3. Operating expenses were up 5.9%, which is about $5 million. Our non-operating net revenue, as you can see, is down considerably. we're using quite a bit of our reserves for our construction projects, so we'll just continue to see that. Still trying to get the best rate of return we can on any short-term CDs. But overall, we're down, that didn't get changed if I put a new one out there, but we are actually down about 30% in our net income from all operations. Any questions on July? I do put the four-year comparison up there, as you can see, for outpatient visits. Still are higher than we were in the previous few years, a little bit lower than last year. ER visits very consistent, around 500 a month. Surgical procedures, I've just continued to see an increase there. Increase a little bit there for our physicians clinic visits too. Average behavioral health visits pretty consistent, up a little bit in the last couple of years. Average daily census just continues to go down as it's harder and harder to get people, insurance companies to cover inpatient services, and births were pretty consistent there for the first month of the year. So that's where we are for the 4 years. If we want to go on to August, and we can approve both at the same time if you'd like. So August, again, there we see the outpatient visits go up a little bit there, and for all our outpatient services to 5,522. What happened there?
I don't know.
It's possessed. So year to date for the 2 months of this fiscal year, we're up 0.3% in outpatient visits. ER visits, again, we were high at 547 in August. Year to date, we're up 10.5%. Surgical procedures, we were pretty consistent with August of last year, but year to date, we're up 3.9% to 265 so far. Physician clinic visits, we had 3,790.
Must be a time limit.
Yes, the auto advance on that slide.
Yeah.
So year to date, we're down in our physician clinic visits of 4.4%. Behavioral health, we had 1,145 visits in August compared to 1,026 last year, up 9% in that area. Had a little more inpatients. Our average daily census was 7.13. So we are at 5.75 for year to date, which is a 16% decrease. We had 7 births in August compared to 13 last year. We're at 18 so far for the first 2 months compared to 23 last year. Year to date, we've had 11 million in revenues, 10 million in expenses, and $319,000 in non-operating net. So we're at almost 1.4 million, which again, that's a percent need change. So we're up 11.2% in net income from all sources for the first 2 months of this fiscal year.
I can let it go.
Again, just have to do the same thing. There we go.
Now that this is the 4 year.
So for the 4-year comparison, as you can see there, again, we can just continue to see our outpatient visits grow. We also continue to see our hospital visits grow. Surgical procedures are growing. There's got to be a typo in that 25 there for physician clinic visits. So physician clinic visits, yeah, should be at 7298 instead of the 42. Yep, so we continue to be around that 73, 7400. Yeah, that doesn't look good. So our behavioral health visits, again, have been pretty consistent. They're up good this year, comparable to what we were in 2022. Just had some fluctuations in staff there. Continue to see our average daily census go down. Births there, you can see we're up the last 2 years, higher than we were the previous 2 years, so we're still on good projections there, and just have continued to see our revenues exceed our operating expense increases throughout the year, so we continue to see a good bottom line from net income from all sources there. So, any questions on these 2 months?
Do you think the increase in surgeries are like mainly for the robotic assisted part of it? Some of it, you think people are
Some
coming for
just,
the robot, or just probably a little bit of everything?
I mean, I think it's hard to determine because we haven't had a consistent full-time surgeon for a while. We've used the locum tenens, so I think some of it is maybe robotics, because that's what he does, but also some of it is just that we have a full-time surgeon right now.
Right.
Yeah.
Great. All right, no questions. Can I get an approval for the July and August financials?
I would make that motion.
First, do I got a second?
Second.
And a second, all in favor?
Aye.
Opposed, same sign. Motion carries. Larry, did you have anything else to add?
No, I don't have anything else.
Okay. Nobody else has anything? Just to mention a few upcoming events there we have on our agenda. The meeting's coming up, so you want to make note of that. So if nothing else, can I get a motion to adjourn?
So moved.
First, do I have a second?
Second.
And a second, all in favor?
Aye.
Opposed, same sign. Motion carries. Thank you.
Thanks, Mike.